Welcome back to Teaching in Scrubs. I'm so excited to be on with you today talking about clinical teaching.
Yeah, this is like the meat and potatoes part of our stuff now, so I'm excited to talk about it.
Yes, I'm so excited to kind of chat about this and hear other people's perspectives too. And we have so much to share about getting started. I mean, doing a good pre-brief and getting our mindset in the right place is so helpful for our students and really facilitating that. That's what I love about these strategies that we use is we are really role modeling how we want our students to approach the clinical setting.
Yeah,
Uh,
yeah.
I really wanted you to share your perspective on, that transition from clinical expert and expert preceptor to clinical faculty of a large group of students.
Yeah. Um, I think, yeah, this to me feels like this is where we're getting into like true, but what am I doing? Right? Like we've talked about, you get thrown into this role as a clinical faculty member, or you don't, you get recruited and you're really excited about it. I use the word thrown, but a lot of times people are going, but what do you actually do in there? So I love that our next couple episodes of this are going to be really digging into that. So for this first one, I wanted to talk about just the kind of the paradigm or mindset shift we go from, like I said in the last episode, taking off this hat and putting on this bright, sparkly, glitter-laden one. And that's different and understanding that which can be a challenge, especially when you are teaching on the unit that you work on, right? So the way that I really think about this as um, whether you've been a charge nurse or not, you know what a charge RN is doing, right? And so I really think of us as kind of the charge nurse of this group of clinical students. So in my state, we tend to have about 8 or 9 students. Um, and so it's really managing them. My job as a clinical instructor on any given day is to make sure that I am supporting those students and facilitating their learning, right? But I've also got a couple other parties to really care about. That's my patient or the patients that my students are working with. Obviously, the baseline is making sure that our patients are safe and cared for. And then the other party here is the nurse who's assigned to that patient because we're there for a portion of the day, but the nurse is still their nurse, right? So it's trying to figure out how to balance student learning and their experience with safe patient care and supporting the RN and working with them and not getting in the way, right? Like that's the big, I refer to them as these little triads before of trying to figure out um, how to support those guys, right? So,
Mhm.
um,
And do it in an organized way that you're checking in with everyone and making sure that student learning is on track. But again, like you said, that we're not a burden in the patient care setting, but
right,
we are really there becoming part of the care team. Again, that's something that's so important for our students to grasp and not treat it like an academic learning setting, but
yeah,
hey, I'm here to work, I'm here to be part of care, and I'm here to become a great clinician, right?
yeah, yeah.
So it's a lot to organize and manage. I love that you call it a triad because you're really kind of being thoughtful of all three of those groups while you're making your assignments, but then as you do your checkbacks during the day.
Right, right. That's kind of the driving graphic that I have in my mind is that little like I kind of think of them as like little balls in the air, right? And I'm trying to make sure that I'm keeping all of them, and at any point in time, I'm managing to make sure they're all in a nice flow, right? So because of that, organization is a big part of the day, right? And as I talk through these things, Sarah, like you and I have gotten some great questions over the last couple of years. So if there's things in here you think about that continually come up, make sure you remind me because I'm trying to think of like the things that we get when we talk to our new clinical faculty. But um, so as I'm doing that, I'm trying to make sure students aren't shadowing, right? Because if you think about those three, it's real easy for one of those, the student, to go hook up to the RN and just follow them around, right? And I'm trying to make them a little independent so they are learning. And like you had just said, this is when we are taking all this stuff we're learning in our didactic or our skills lab or our assessment class and like practicing it, right? So, yes, we're doing teaching in the clinical setting, but I often think it's also really just going, you have learned this, so now it is my chance to give you a chance to go practice it, right? And
Mhm.
so, so it's like coaching them into that. Um, so students aren't shadowing. The other one kind of pearl that I got years ago was keep your hands in your pockets as a faculty member. So um, I if you can keep your hands in your pockets and go in and have some patience and let your student work through the skill or the assessment or the scanning or the bed bath or the whatever it is, it's going to take them longer, but they are going to learn, right? Um, Provided things are safe. So it's real easy sometimes to go, okay, we just got to get this done. I'm going to do it, right? And there's
Right.
a time and place for that when the student clearly is like, this I'm out here, this leash is way too long and I need some help.
Right.
Throw me a life vest, right? Then I can come in and go, yeah, I can help you. But as long as I know that they are psychologically safe, it's okay for me to go, you got this, right? And you can't hurt anybody if you're hooking up tubing wrong that's over at the wall that's not even attached to a patient yet, right? Like I'm thinking of like setting up suction canisters in a room before an admission, right?
Yeah. And it's so easy to try and rush or to try and like show one, do one. Right. But I think you described really well the facilitation of
Hmm.
learning. And
Yeah.
that physical putting your hands in your pockets makes you take a slower breath. It makes you a better listener. That's the other thing is sometimes we don't give them a chance to say what they were going to say because they're processing. That's another thing
Yeah.
about that pearl that you've gotten is because sometimes if we are doing, we're also not letting them talk out loud and work through the process. So it really does allow for you to remember to be that facilitator.
Yeah. And I had a patient this semester who um, wasn't able to speak, and I kind of let the student just do all the speaking. And this eye contact was great with this patient because they just looked at me like, I see what you're doing here. And I was kind of like winked, like, and then they wrote me out on a piece of paper. I used to do training in my previous job, so I really appreciate what you're doing. I was like, thank you. But sometimes you got to let them, the students, you got to have like a little bit of an uncomfortable silence, right?
Mhm.
Which is a lot more acceptable in like an academic teaching situation, like an academic teaching environment. But I think keeping your hands in your pockets. So, and some students, back to see one, do one, teach one, some students really, really do well by that and say, I haven't removed a Foley catheter in a year, and I really want to see you do it. Um, and so, depending on the skill, I might say, sure, I'll do one first. That one, I might say, I'll be there with you, but I'm going to let you do it because, or we're going to do the C1 out in the hall and we're just going to talk through it, right? So, um, really what it comes back to though is having patience and
Mhm.
being willing to take the time and say, it's okay. My job here today is to support you, student, right? I am, this patient is safe. They're going to get taken care of. Right now, this is your learning, and students are going to learn so much better when they are in that position of like, ooh, I got to do this myself. But that's where you see this tremendous growth in
Yeah.
confidence.
Yeah.
So,
Mhm.
um, the other thing, so we talk about this mindset shift. So we're going from being an RN who's doing the things to being someone, a facilitator or coach who's got hands in pockets, right? To also keeping in mind this RN patient student kind of triad. I'm also kind of thinking what opportunities are happening. Like, so I'm looking at those groups. So I've got 8 of those groups essentially, right? But I'm also keeping note of, well, what do other patients need? I'm hearing there's an admission. I'm hearing there's a discharge. So that's a big part of also just kind of keeping all the stuff in your brain as to what's going on. Much easier if you're on a unit that that you know, right? You know that population. Um,
I always think too, if you're at a point in the semester where whoever sits at the nurse's station who also kind of helps facilitate, whether that's charge nurse or a unit secretary, if they start paging out to you or coming to find you to say, hey, guess what? This is going on in room 2. I sent your student in there, or do you want
Yeah,
your student to go? Like, you know, you're on the right track with the semester if you start, it takes a couple of weeks for the unit.
totally. Yeah.
Or if they do it from day one, you know,
Yeah.
got kind of a good group to work with.
Yeah. So the other thing I'm doing as those things are in my mind is I'm taking good notes, right? Like, so whatever works for different people, but I've got like a grid, right? Where I've got columns of time across the top and students as the rows, and I'm just making notes in there. That's what works for my brain. It might be post-its. It might just be a running piece of paper of this patient's going to get discharged, so we're going to do that in an hour, or um, just so I can keep track. Or this student did a really good job on this thing. So like later on, when I'm reflecting on notes for the day, I've got some type of extemporaneous notes of how the day went, what happened. That's just really helpful for me, or
Mhm.
something I want to follow up on. So taking
Yeah.
lots of notes and having a way to organize is really key.
Yes, I really like the grid. It reminds me of being charge nurse and going around and doing your checks at certain points
Hmm. Yeah,
in your last checks of the shift so that you know how to help the next shift charge nurse make their assignments. I kind of see it like a mini version of that in a lot of ways because
yeah,
you're it also helps to check in with nurses. Is there still that secondary antibiotic to hang? Because we would love to hang that.
right.
Those are the things
Yes.
I liked. I have my little highlighter in my pocket too because I'm like, if we have to reprioritize, I want to do these things in pink or yellow.
Yeah, yeah. Two things is kind of managing your stress in the role, because there will be some, right? Is because it's new, right? It's real. Once you've done this, because it's just new, sometimes you're like, oh, being a bedside RN is so much easier, right? And
Yes.
that's not, I mean, I don't think so now. This is easier to me because I'm comfortable with it, but there is this sense of this is new and you're learning and you have your own learning curve to climb. So be fair to yourself. Um, Manage your stress, take some deep breaths. So, and this kind of gets to the other thing I was going to say, which is putting yourself in the shoes of the student, right? And recognizing how much learning is happening, how challenging this is. And sometimes just going in to talk to a patient and being able to have a conversation is a huge win, right? And depending on where they are, and like the new students or students who are going into clinicals for the first time, that's going to be the win. And that's really hard for people in the beginning, especially younger people who are like, I don't ever usually talk to people who are over 50, right?
Yes.
And now
Or
I have to have a casual conversation with them.
while doing work and things that I've only practiced.
Right,
Absolutely.
right, right.
Well, so, what would you say is helpful to the new clinical faculty who is trying to set some of those micro goals for themselves? Very similar to our student having a win of, finding some common ground to talk about and make small talk about, and just get in and out of that room the first couple of times. What are some of the micro goals where it's like, that was a good day? I have some things to work on, but that was a good day.
Right. I think one thing that I like to start each day with is, and we'll get into this when we talk about kind of how to design a day, but I like to start with just kind of some breathing exercises with the group. It really helps me when I'm the busiest part of the morning. And again, we'll get to this too in another episode, is figuring out patient assignments, right? And I do that before the students show up. So by the time they show up, I've been running around all morning trying to put all these pieces of this puzzle together. So when they arrive, taking some breaths, right? Practicing, like, let's just take a couple big breaths together and kind of set aside the outside world for the next couple hours, trying to establish this clinical container, if you will. It helps me get centered. It helps them get centered. You don't have to be like a meditation or breathwork expert to do that. It's literally like, okay, let's breathe together and let's maybe set an intention, or one thing that kind of works is going, a lot of you wrote about what your clinical goals are, right? What did you, last week you might have said, next week I want to do this. So think about that. Think about maybe one thing today that you want to do, right? So that um, helps guide goal setting. So I don't have 50 things in my mind, right? I still have the 50 things in my mind, but I might be able to go, okay, but today I'm going to really go talk to a patient and ask a couple questions and listen to them, right?
Mhm.
Um, and at the end of the day, like the way that I kind of, from a micro goal standpoint, um, I think what's helpful is just to have people to hear. For me, I feel good when I have students reflect on a day in post conference and they're truly sharing kind of what their wins were and what their challenges were. So some days you're going to have a whole bunch of wins and some days you're going to have a lot of challenges, but a really good debrief at the end of the day for me feels like, okay, everybody learned a lot, whether it was challenging or or really fun, or maybe both. Everybody learned a lot today. And for me,
There-
that feels like it was a good day.
Absolutely, yeah. There's engagement and um, you even if you like you said, even if you don't meet all of your goals for the day, that everybody has some takeaways to build on their experiences.
Yeah, yeah. But that's, I think those are the biggest points from kind of that mindset shift. And, you figure out how to work really well with the other RNs on the unit, um, being a partner with them, reminding them that, hey, I'm an RN too, and I can help you, right? So I feel like we've really won when student nurses go, oh, cool, students are here today, right?
Absolutely.
Yay! We're excited because we know that you are a value add. And students feel so much better when they know that they're being received really well too. So creating that kind of environment, I think, feels really great and makes it even more fun.
Yeah, and I think we're going to talk about more tools of how you set that environment up because it is very intentional. You
Yeah.
can't walk on the unit and expect it to be a great learning environment. I've walked into some semesters and thought, "Wow, this is going to be tough." Just because maybe I was walking into a setting that didn't have the healthiest environment at that point in time for various reasons. But it often ended up being the best. But I felt like because I had that perspective, I worked extra hard to win over the staff, right?
Hmm.
But also to kind of create an environment before the students arrived and to be dynamic and probably more flexible than I had been in the past. And so there was one more thing about the mindset shift that I wanted to make sure we talked about because it was kind of along those same lines of there's been some really tough clinical teaching times in the last 5 years. And
Yeah.
I will never forget seeing you in faculty orientation for the first time and being so excited that you were there. So relieved to see a friendly face in the middle of the pandemic because your first semester teaching was the first full semester we went back. We'd been there in the summer, we went back
Yeah.
in the summer, but on a very small scale. So you came back pre vaccine, still in kind of the throes of the second wave. Uh,
Yeah.
I just remember being like, "Hi, Laurel," and you saying, "I really need some resources. I really need, to know what to do next week because we were, less than 5 days
Yeah.
the actual clinical days at the hospital starting." And but I remember you saying, "But I've talked to my friends and I've got
Yeah.
some tools,
Yep.
but I need more." And I think that's one of the things that's stuck with me is that you started during one of the toughest times in, our recent
Right.
history, but also that you were coming in and kind of seeking out not just that formal mentor, but you sought out a lot of informal mentors. So really leaning on colleagues and networking
Yeah.
and looking for resources on site.
Yep.
But also, there's lots of great resources that we'll be sharing. I think we'll share our favorites. I always love to share, what we're reading right now, but then our kind of go-tos, our
Yeah.
oldies. But I just remember you being so willing to go out there and seek out the information and being unwilling to teach the way that, people have taught before, right? You're like, I
Yeah.
want to do this well in a really hard time.
Right. Yeah, that was hard. That was just part of the reason that you and I started doing this was this is such a fun job, but it is a steep learning curve in the beginning,
Mhm.
especially in the absence of the instruction manual,
Right.
right? So, so yeah, um, it was hard. I remember connecting with students then and just going, this is a challenge, but it's a challenge for all of us right now, and everybody is a little scared being here and, but yeah, but thanks for saying that. I think yeah, I leaned on colleagues like you and others who just had great resources. And I think a big part of it is finding like, ooh, I like this welcome letter. I like this organizational grid. Ooh, here's a scavenger hunt that you put together, and I could use this for my unit. So that's a huge part of it is finding good resources. And yeah, we will absolutely share some of those things that have worked well for us. But yeah. Okay.
Fantastic.
So next time we're going to come back and you're going to talk about designing a semester, big picture, your Google Earth picture. And then after that, we'll talk about really getting more granular and talking about a clinical day. So fun stuff coming up.
We're building the house.
We
I
are,
always
we,
your visual. So the visual of building the house. We're
yeah,
starting to lay the foundation. Now we're going to kind of look at the big picture blueprint and then get down to actually building day by day.
yeah,
Love it.
yeah. Okay. We'll see you next time.
Okay, bye.
Bye.